Hi, I am Dr. Nicolette Powe, Associate Professor of Public Health here at Youngstown State University. I always say, when people ask me, like, what is public health? And I always start with this: public health is everywhere. It affects everybody. When we think about the foods that we eat, when we think about the water that we drink, when we think about the air that we breathe, when we think about the fact that we have sanitation, that someone comes and get our trash and manages that, all of these are little examples of how public health is working to protect all people. We're really looking to help with ensuring that people can live their best lives by having an environment, may that be a social environment or a physical environment, that's conducive to them living the healthiest life possible. The thing that makes YSU's Masters of Public Health program, also referred to as the MPH program, unique is that in our program, we are fortunate that our students have the opportunity to work with other students at other universities. For example, Youngstown State University is part of a consortium, and in this consortium, our students actually interact with students from Cleveland State, the University of Akron, and the medical school, Northeast Ohio Medical School. I think that combination is really unique because now you get to interface with future MD doctors. You get to interface with people from other universities, and they're all coming together and blending their perspectives and their experiences. And I think that's where the growth is, because you're getting to interface with so many different and diverse types of people who come from different backgrounds, but your common goal is the Masters of Public Health. And so each of our students tend to bring their own perspective and their experiences. And because of the uniqueness of our combined universities working together, I think that's what makes it so rich. With the Masters of Public Health program, one of the things that we are really focused on is our students getting real life practical experience. And I think when we talk about public health, you really kind of want to have some hands-on. You want to kind of get an idea about what you think you might want to do in the future. And if you don't know, that's the beauty of our program, because many of our course assignments are partnered with what we refer to as community partners. And so we build our class assignments around what is the need of the community and how might our students be able to get real-time, hands-on experience in doing things that they may be doing once they graduate. It's not that busy work that typically you just write a paper, but it's really about we're trying to solve a problem, we're trying to address the issue. It may be program evaluation, it may be quality improvement, it also could be how do we plan for a new program or program implementation. And so again, I think that's the richness, because you really get to kind of see, like, I really like that, or I didn't know that could be a possibility. I didn't even think about that's connected to public health in some way. And I think that's, for me, is what makes public health so exciting, because it's not limited to that you just got to have a clinical experience. You can work in the community, you can work in a lab, you can work for the state health department, you can work at a health department, you can work at a nonprofit organization, you can work for an employer and do employee wellness. That's the beauty of public health, that it gives you so many options that allows you to really show your versatility, and most importantly, for you to find your niche. And I think that's what makes it so exciting for public health.